Allahu Akbar, Allahu Akbar.
दौरे नबूवत में मस्जिद सियासी, समाजी और सकाफती कामों का मरकज हुआ करती थी, लेकिन दौरे हाजिर में ऐसा कम नजर आता है। अलबत्ता अमरीकी रियासत न्यू जर्सी में एक मस्जिद ऐसी भी है जो खालिक व मालिक की इबादत के साथ साथ सियासी, समाजी और सकाफती तकारीब का मरकज भी है।
अल्लाहुम्मा सल्ली अला सय्यिदिना मुहम्मदिन नबिय्यिल उम्मी व अला आलिहि व सहबिहि व सल्लिम।
गुज़िश्ता दिनों मस्जिद अली में एक खुसूसी कम्युनिटी हेल्थ फेयर का इनेकाद हुआ, जिसका मौजू था प्रिवेंशन इज द बेस्ट मेडिसिन। इस हेल्थ फेयर में वजन की अहमियत, खाना, बर्ताव, बच्चों और बड़ों के नफ्सियाती मसाइल और डिप्रेशन, सेहतयाब दांत और दीगर मौज़ूआत शामिल थे, जिसमें मुमताज माहिर डॉक्टरों ने हाजरीन को न सिर्फ लेक्चर दिया बल्कि उनके सवालों के जवाब भी दिए। डॉक्टर अली हसन ने इस मौके पर मेंटेनिंग अ हेल्थी वेट के उन्वान से खुसूसी लेक्चर दिया।
So when we talk about healthy weight basics, the nuts and bolts, it really comes down to what you eat and what you're doing, diet and exercise. And diet in terms of calories taken in and exercise, calories burned. Let's start with diet. It's important to maintain a normal caloric balance in what you eat. There's 3 types of nutrients that you all know of: fats, proteins, and carbohydrates. Carbohydrates provide 4 calories per gram. And in general, like I said, I'm not going to go into very specifics, but in general it's important to eat more complex carbohydrates such as fruits and vegetables, and avoid those processed foods and simple carbs such as sweetened beverages, pizza, white rice, pancakes. Proteins also provide 4 calories per gram. It's important to include fish, lean meat, poultry, eggs, beans, peas, and soy products, unsalted nuts and seeds. Fat, which is the most calories per gram. Now there are 2 types of fats, ones that are healthy and ones that are not. Trans fatty acids contribute to heart disease, and they are found in margarines, hydrogenated vegetable oils, and in cookies, chips, a lot of fast food and junk food. Eating more omega-3 fatty acids, which is found in fish and fish oil, are known to be preventive for heart disease. In general, I recommend my patients to cut 500 calories a day at minimum if they're overweight. I'm sure you've all seen the food pyramid, and this comes from the U.S. Department of Agriculture. And the problem here is that we don't eat enough of the foods that are in this pyramid, and we eat too much on the top here: fats, oils, and sweets, which we should really sparingly eat. Milk, yogurt, and cheese, meat, poultry, fish, dry beans, eggs, and nuts, vegetables, fruits, and bread, cereal, rice, and pasta should really constitute the majority of what we eat. Now, a lot of the times, and I've had the same trouble, is how to really take home the message of this pyramid. And they've actually came out with, or Harvard came out with a sort of a food plate to really make it something from an abstract pyramid to what's in front of your face when you're eating a meal. So I think this is helpful. In your meal you should have a drink of water, not soda or iced tea or any of those sweetened beverages, whole grains, healthy protein, fruits and veggies. And again, the majority of Americans don't eat this type of a diet. In terms of the best results, it's a combination of both a healthy low-calorie diet with your daily exercise. I encourage all of you to talk to your doctor, family doctor, to develop a plan. Make realistic goals and track your progress, and maintain your success. There's a lot of apps now, pedometers, that really help in tracking your progress and making it a daily thing that you can do and incorporate in your lifestyle. I'd like to end with a quote from Imam Ali. There's a lot of wisdom in our Imams and Prophets. How strange and foolish is man, he loses his health in gaining wealth, then to regain his health he wastes his wealth.
डॉक्टर आजिम हुसैन का मौजू था प्रिवेंटिव हेल्थ केयर इन पेडियाट्रिक।
We all know that health is highly regarded in our religion. So our bodies and health are gifts from God, and Imam Ali alayhi salam has said that health is the best of all blessings, and if our bodies are entrusted to us, by God, it is our responsibility to do the best we can to safeguard and protect, our health. So I'm a pediatrician, and a pediatrician is a doctor who's specially trained to take care of all aspects of the health of children. So in terms of preventative health care in pediatrics, we recommend, regular visits with the pediatrician. We recommend 6 visits for the first year for a baby. There's 3 visits that are recommended in the second year of life, and then usually when the child is older, beyond the age of 2, we recommend 1, visit annually. And there are certain areas that we always assess, with all children who are coming in. We assess their growth, diet and nutrition, which you're hearing about today, the development of the child, and finally the vaccination or immunization status of the child. For growth, what we do with every visit is that we measure the child's weight, height, and head measurement. And these measurements are plotted on growth charts, which you can see here. And what they help us to do is they help us to compare the growth of the children we're seeing to children of similar age and gender. And we, see how the children are following, their growth plots. And if a child is plotting on the lower end of the curve, it doesn't necessarily mean that they're not healthy. Or on the flip side, if a child is plotting on the higher end of the curve, it doesn't mean that they're, not healthy either. What we look at is more how they're following their curve, and we don't want to see too many deviations from the normal velocity of growth. Unfortunately, what happens is, when a child, is diagnosed with something like this, we're always trying to figure out what has caused it, and there's a lot of research being done in these areas to figure out, what's causing developmental problems, and a lot of the current thinking is that there might be some genetic component to it. We do see linkages in families where some of these problems may arise, and there are certain environmental, triggers that may also contribute to some of these problems. But what we always try to counsel the families is that, the benefit of the vaccine does outweigh the risks associated with it. One of the big concerns came from a preservative that was used in vaccines called thimerosal. It was a mercury-based preservative that was being used in vaccines. And none of the research ever showed any link between this preservative and any developmental problems, but because of the public concern about the safety of the vaccines, the thimerosal has been removed from most vaccinations, and that happened dating back to like 10 to 15 years ago. But even since that time, we're still seeing more and more cases of developmental problems in kids. So, that tells us that there's something more than just the vaccines that are involved in this, and hopefully, again, with better research, we'll have better understanding of what's causing some of these problems so we can, prevent some of these outcomes from happening. But the point is that, it is safe to vaccinate the children. And unfortunately, I think what's happened also is that a lot of the older parents who have seen some of these illnesses have seen the devastating effects that some of these illnesses like measles and polio and rubella can have. But some of the younger generation of parents, unfortunately, living in a time where they have not seen a lot of these diseases, really have started to fear more the vaccines that prevent diseases as opposed to the disease themselves. And I think that's something that, we have to counsel our community on, we should not think that way. And these vaccines are readily available at your primary care physician. There are certain travel clinics that offer these vaccines, and even some of the local pharmacies that provide vaccinations can provide this vaccine as well.
नफ्सियात और डिप्रेशन के हवाले से डॉक्टर असद हुसैन ने फरमाया,
I'm going to change the pace up a little bit and talk more about the mind. We've covered the body and the physical aspects. Mental health is just as important as physical health, and I think in our communities now, it's becoming a growing concern. More so because I think that symptoms are becoming more in the forefront. So people are not able to ignore it any longer, and they're seeking treatment, which is great. I think in our communities, we need to be more aware of the mental health aspect and not just kind of push it to the side. So let's start off with depression. So major depression, just to give you a couple of facts, generally in a lifetime course, about 17% of the population will have major depression. It is more common in females. The average age of onset is about age 29. Other symptoms that are associated with depression are anxiety, which is the number one, substance use, as well as any other impulse control disorders, and ADHD. Now, there's certain risk factors that can contribute to depression. So life events, what we tend to call psychosocial stressors. So things that happen in a person's life externally that can contribute to depression. So loss of a parent before age 11, any kind of childhood abuse, whether it be physical abuse or sexual abuse, unemployment, retirement, losing a spouse. Genetically, meaning if it's heritable, 2 to 3 times more common if relatives have them. More so first-degree relatives, we classify as parents, siblings. And then also in identical twins, there's a 50% chance. So we have one variation which is called, when you classify depression as melancholic depression. And the major hallmark there is that there's lack of pleasure in everything. And the other aspect to consider is that even when there is a pleasurable activity, the person will not show a positive response. Like people that don't have depression, when they are shown in front of a positive stimulus, they're happy. Someone with depression, they could care one way or the other, especially if they have this feature of depression. Now, the other type of variation of depression we have is catatonia. Now, in catatonia, there's certain symptoms that you look for. So one is that a person can be in a stupor, that they're not actively engaging with the environment. And the other aspect is a symptom called catalepsy, where they're basically fixed in a certain posture. You try to turn them, they're not going to turn. You try to move them, they're not going to move. Mutism, lack of a verbal response. Now, catatonic patients, people think that it implies that they're not moving or they're not talking. It could be the opposite, where they're moving too much or they're talking too much. And they can mimic your speech. You say something, they're going to repeat it. It can get quite annoying. And they can even mimic your movements. Okay. Other things with cognitive behavioral therapy, relaxation techniques, deep breathing, muscle relaxation, guided imagery, having positive pictures that can kind of calm you, soothe you, make you feel less depressed. Skills training, so social skills. Oftentimes patients that have depression or even anxiety, they have very poor social skills. Making them more assertive increases their confidence, makes them more, gives them a better self-esteem about themselves. Exercise and diet. Exercise I'll go into later as well in terms of how it has been shown to improve mood and depression and self-esteem. Now the dysphoria, meaning like the negative thoughts, the negative feelings. With bereavement, they're triggered by the thoughts of the deceased. Whereas depression, they're autonomous, meaning if there's no trigger, they just come randomly and there's no explanation for what is causing it. Sometimes there can be triggers in their life that have caused the depression, but more so with bereavement, the trigger is more or less definitely the deceased. And the onset of bereavement occurs within 2 months, whereas depression, it can occur anytime. And the duration of depression with bereavement is less than 2 months, where with depression, it can go from 2 weeks to 2 years, and that goes into more into dysthymia, which is classified as functional depression. And the biggest thing with bereavement also is that the lack of, it does not impair your functioning. You can function day to day, but people with depression, they have severe functional problems. And there's no family history of depression with people that are going through bereavement, where on the latter, with major depression, there is family and personal history. Now, grief therapy is basically, it can be individual or groups, and it's basically meant to help the person cope with the loss, re-enter society, deal with their feelings. Oftentimes when people lose someone, they say that when they have ambivalent feelings or they have angry feelings, they think that's not normal. The purpose of these groups is to show them that these feelings are normal and they need to address them. The self-help groups that they have offer companionship, social contacts, emotional support, and basically it becomes an extension from the family. Oftentimes what happens is that when the family can no longer provide support, these self-help groups are an extension of that, so they still provide the camaraderie and help the grieved one deal with the loneliness of their loss.
Basic food care for the everyday adult. इस हवाले से डॉक्टर रॉबर्ट बायर ने तफसीली गुफ्तगू करते हुए कहा,
just showing some common foot disorders, and then as we progress through, I'm going to tie it into what we could do for prevention of having these problems. This is a slide showing a flat foot. It's very important to understand, with the flat foot, a lot of people think you need to have it treated, especially in pediatric flat foot, and that is actually not true. The medical literature shows that unless it's a very hypermobile, a very flexible flat foot, it doesn't necessarily need to be painful, but you're seeing decreased activities of living with the child. You're going to see that if you're, say, down the shore walking on the boardwalk, instead of them running ahead of you and you trying to keep up with them, the hands come up, pick me up, pick me up. It's a sign of them being fatigued. Those types of things where you're getting fatigue syndromes without pain, yes, You can see in the picture is an orthotic, a foot insert to try to help control the motion. So if your child has pain, if you have fatigue syndromes, or as an adult you have it, then yes, you can treat this disorder. Orthotics are very helpful. Surgery I won't go into, it's beyond the scope of this lecture. Hammer toes can be very painful. It's a bend in the toe. You can see it on the right. It clearly shows what happens. All of us, or most of us, for most of the day are going to be in a closed shoe. The toe box of the shoe, if it's low, hits the top of the toe, and you can see right there on the left how red and swollen, and you can visualize in your mind, hopefully, how painful it is. Again, I'm going to go back to proper shoe gear. If you have a hammer toe deformity, wearing a shoe with a high toe box or made of a material that is stretchable, such as a nylon mesh in a running shoe, or wearing an orthopedic shoe that's a double depth shoe, you can have the deformity, but you can accommodate the deformity and therefore not get a problem. This is important as I go down the line, because you don't want it to become open, a wound, an ulcer. Because if you look at that diagram, you're going to see on the right, there's very little spacing between your skin and where you get to the joint. So those are problems in our diabetic population, especially our older populations with poor circulation, that a little wound could rapidly be an infection that goes right into the toe, and that's where you hear about, oh, so-and-so had a toe amputation. Proper shoe gear. In terms of the width, it's a variable. A little bit of extra, a pinch extra if you're not going to be doing a lot of activity and you're not going to worry about getting an excessive inflow. But if you're a runner and you're going, you want a little bit more room, because what's going to happen over a period of time is your arterial inflow from your activity is going to outpace the veins, bringing it back up to your heart to recirculate. So over a given period of time, you're going to have swelling, and you want to have a shoe that's wide enough. Very common in runners, or people are running on treadmills or doing ellipticals, is exercise-induced neuropathy. And what happens is that arterial inflow pumps, but the veins can't take it away, so you get a compression syndrome. The best way to people to visualize it who aren't a doctor is think of a bottle of soda. It's 32 ounces, and maybe there's a half ounce on top of airspace. If I took in a needle and I had a hydraulic pump to pump in air, can you visualize that plastic bottle expanding, and it could pop? Well, your foot doesn't pop, but the pressure on the inside, what we call the interstitial pressure, goes way up. And you have nerves in your foot. And it's very common for that pressure to be enough to cause pressure on top of that nerve, and your foot goes numb. Stop exercising, 5-10 minutes later, it goes away. One of the other things you could do to prevent that is cross-train. We were talking before about exercising 5 times a week. As a podiatrist, I'm going to tell you, please don't do that doing the same repetitive exercise routine 5 days a week. I'm a very big proponent of cross-training, whether it's jogging, cycling, swimming, elliptical, stepper, but don't do jogging 5 times a week. You get overuse injuries. You're not mixing up the muscle groups the way they're used. I personally feel, my personal preference, you get a better overall health benefit if you cross-train and don't do the same exercise 5 days a week. If you really love it, then do 4 days a week of running and 1 day of something else, 2 days of rest.